Welcome, future nurses, to LPN LaunchPad's presentation on the importance of physical assessment and nursing health history. This comprehensive guide is designed to help nursing students understand the critical role of assessments in patient care. In this session, we will discuss the following key areas: the importance of physical assessment, the systematic approach to head to toe examinations, preparation strategies, and the significance of obtaining a comprehensive nursing health history. Physical assessment is a foundational skill in nursing practice. It enables healthcare providers to gather crucial data about a patient's current health status, identify both obvious and subtle signs of illness, and make informed clinical decisions. Assessments guide nursing interventions and help evaluate the effectiveness of care plans. An initial assessment establishes a patient's baseline, which serves as a reference point for future evaluations. Comparing new findings to this baseline can help detect early signs of disease progression or treatment effectiveness. For example, fluctuations in vital signs such as blood pressure or temperature may indicate an infection or worsening condition. Physical assessment is not a single event, it is an ongoing process. Regular patient evaluations allow nurses to monitor changes in health status, detect complications early, and implement timely interventions. For instance, identifying abnormal lung sounds early may prevent respiratory distress. A structured head to toe assessment ensures comprehensive evaluation. It follows a systematic sequence covering major body systems, including neurological, cardiovascular, respiratory, gastrointestinal, genitourinary, musculoskeletal, and integumentary systems. A thorough assessment includes evaluating both normal and abnormal findings. Key areas to assess include vital signs, physical appearance, and functional abilities. Nurses must pay close attention to subtle changes such as variations in skin color or temperature, which may indicate circulation issues. To conduct an accurate assessment, nurses must be proficient in using essential tools such as stethoscopes, sphygmomanometers, pen lights, and thermometers. These tools should be clean, calibrated, and in good working conditions before each assessment. Ensuring patient comfort and privacy is crucial for an effective assessment. Explain each step of the examination to the patient to alleviate anxiety and encourage cooperation. Additionally, the environment should have proper lighting, minimal noise, and an adjustable bed or examination table for accessibility. Accurate and timely documentation is an integral part of patient assessment. Nurses should record both normal and abnormal findings immediately after the examination to ensure clarity and reliability of patient records. The nursing health history is the foundation of the assessment process. It provides insight into the patient's medical background, lifestyle, and overall well being, guiding the development of an effective care plan. Key areas of data collection include wellness levels, lifestyle changes, sociocultural influences, and emotional responses to health conditions. The primary goal is to identify patterns, risk factors, and resources that can assist in managing the patient's health. Establishing rapport is essential in obtaining an accurate health history. Nurses should introduce themselves, explain their role, and communicate the purpose of the assessment. Professional demeanor, confidentiality, and open body language contribute to a trustworthy environment. Biographic data includes essential patient information such as date of birth, gender, address, marital status, occupation, and insurance details. Verifying this information ensures completeness and accuracy in medical records. Understanding the patient's primary concerns and symptoms is key to an effective assessment. The OPQRST method is used to evaluate symptoms systematically. Onset. When did the issue begin? Provocation, palliation. What makes it better or worse? Quality. How does it feel? Radiation. Does the pain spread? Severity. How intense is the symptom on a scale? Time. How long has it lasted? A thorough health history includes previous hospitalizations, surgeries, allergies, and lifestyle habits. Family history is also vital in identifying hereditary conditions such as diabetes and hypertension. Additionally, environmental history considers potential health risks in the patient's home or workplace. A patient's psychosocial and cultural background can significantly influence their health behaviors. Understanding factors such as cultural beliefs, primary language, education level, and social support can enhance culturally competent care. For NCLEX preparation, focus on the importance of physical assessments, head to toe examination steps, documentation, and nursing health history components. Emphasize continuous patient monitoring and timely interventions for effective nursing practice. A patient complains of dizziness upon standing. Which assessment finding would suggest orthostatic hypotension? A. A decrease in systolic blood pressure by 10 millimeters of mercury. B. A decrease in systolic blood pressure by 25 millimeters of mercury. C. An increase in diastolic blood pressure by 5 millimeters of mercury. D. A heart rate decrease of 5 beats per minute. The correct answer is B. A decrease in systolic blood pressure by 25 millimeters of mercury. Rationale: orthostatic hypotension is a drop in systolic blood pressure of 20 millimeters of mercury or more upon standing. This condition increases the risk of dizziness and falls. Which of the following statements made by a nursing student demonstrates an understanding of proper physical assessment techniques? A. I should always start with palpation before auscultation when assessing the abdomen. B. I will document breath sounds as clear before listening to all lung fields. C. I will compare bilateral findings for symmetry during the assessment. D prime. I should use the bell of my stethoscope to listen to normal breath sounds. The correct answer is C. I will compare bilateral findings for symmetry during the assessment. Rationale: a fundamental principle of physical assessment is comparing both sides of the body for symmetry. Option A is incorrect because auscultation is before palpation in abdominal assessments. Option B is incorrect because documenting findings happens after assessment. Option D is incorrect because the diaphragm, not the bell, is used for normal breath sounds.
Yep.
This concludes our session on physical assessment and nursing health history. These skills are essential for early detection of health conditions, guiding clinical decisions, and improving patient outcomes. Thank you for your attention, and I encourage you to continue practicing these fundamental nursing skills. Hey there, this is Brian. I am the creator of LPN LaunchPad. I want to say thank you for learning with us. In addition to these videos, I've created a series of free adaptive quizzes in ChatGPT. The link to this video's quiz will be listed in the description below. Help me keep this project alive by hitting the like and subscribe buttons.